think that following the trend of this disease, a rising trend of infected people and dead people, it is important to assure everyone that this COVID-19 is a reality. And families don't have to wait until they hear that one of their family members affected by COVID-19 has died. We are really urging everybody to accept the reality of this, and that it has gained pandemic proportions. It's affecting not only Ghana, but many of the countries around us. It has affected Europe. It has affected America. So I think with the plans government has is to bring the capacity of testing as close as possible to every Ghanaian. If, for example, we had a testing center here in Tamale, I think they are preparing one. And people hear that this number of our family members have gone to test, and this number have been assured that they have tested positive. Then it begins to be a reality for them. But what we want to achieve is that people should not wait until a friend or a family member has tested positive and even died of COVID-19. So we are pleading with our people of all walks of life, farmers, traders, to make use of any opportunity that will be given us for the population to test and know their status. But if we have a testing center or more in every region, people will be shocked or surprised to hear that this our family member who is going about his business as usual is actually a risk to our lives. So this is what I would like to exhort Ghanaians to wake up to the reality of COVID-19 and do everything possible to fight it. Definitely, these measures are not put in place for nothing. And therefore, here again, I would like to exhort Ghanaians of all professions, of all walks of life, to follow faithfully the measures that have been put in place to reduce to the barest minimum the infection rate. And these measures are that we should wash our hands as often as possible in a day with soap under running water. The face mask is one of them, because we emit when we speak, I will say certain substances which can contain a virus. And if we do not protect ourselves and protect those who are near to us, we can be infecting others in this way. So again, I would like to tell Ghanaians that the social distancing is also one of the practices we should embark on. If we have a meeting of 5 to 6 people, we cannot say, oh, because we are not that many, there is no need for social distancing. let us sit close to each other. But that will be a behavior which is not informed, and we could be agents for the spreading of this disease. If we abide by the regulations given in terms of our behavior, we are the very ones who will reap the benefits of it. Because within a very short time, we will realize that the COVID-19 count in the country, which we are given every now and then, if we watch the news, it is now part of the news structure. At the beginning, there were areas where they said there is no COVID-19. Now they are also adding to the increase of the virus count in the country. So let us not wait. Let us abide by these regulations. Washing of hands frequently with soap under running water, wearing a nose or a face mask, and trying as much as possible to observe the social distancing when we come together. And that is why right at the beginning, the only concession which was given was the burials of people. But that one too should not exceed 25. So, my dear friends and countrymen and women, let us take this behavior pattern very seriously, and the compliance will ensure that we will not have to live too long with COVID-19. But if we go against these regulations, within a short time we can see that the population is decimating either through the high rate of infection or even death, which by all means we would like to avoid. I think that observing meticulously the behavior pattern which has been given us will make us have hope, as they have really and actually shown us. You see, a country like Germany, which has a very good health system, they have not been so terribly affected by this COVID-19 scare. It is important that wherever people can support family members to take advantage of the testing centers and know their situation. And wherever people have tested positive and have undergone the treatment and have been discharged, this in itself gives us great hope. We are living now in a country which in terms of expertise is growing in the number of medical personnel that we have, the number of nurses and doctors who accompany these people to safety, so to say. And even those that die, very often it is because of the compoundment with other diseases which they didn't take care of, that the deaths come about. The deaths we are talking about are not all COVID-19 deaths. There are other sicknesses which compound the situation. So Ghana is 71% Christian. I will also appeal to all Christians to keep this hope high through their prayers, and know that if we do what is needful on our side and pray to God and ask the intercession of the Blessed Virgin Mary, we will see that as it happens in history, God will intervene and rid us of this terrible disease which has gained pandemic proportions. The fact that it is everywhere and is at our doorsteps should help us to be serious about following the behavior patterns that have been given us. And also to help people have the courage to go to do this testing. If our own relatives who are discharged come home and we are avoiding him, where do we want him to go? I want to say that there are a lot of conditions which perhaps in terms of the management of the disease are worse than the COVID-19. But our faith and the price we put on supporting family members and friends is so high that we have never had a situation where we abandon our own family members because of a sickness. So let us rather come together, accompanying those who are likely to be affected, to stay hopeful and follow meticulously the instructions that are given them during the isolation period of the health personnel. I would say that the scientific capacity of Ghana is growing tremendously. We have the experts. We have the nurses who are very well trained. And if they admit us and accompany us to recover, Ghanaians should not continue to stigmatize their own brothers and sisters because they have gone into quarantine for 2 weeks or 3 weeks. But we should rather encourage, because as the president was saying, there is in a factory so many people were found infected. And they said it was one person, through one person, that got the so many people infected. Let's take this very seriously, but also with great hope and trust in God. We will see that we will come out together. The main aim of all this, trying to place isolation centers as close to the citizens as possible, is precisely to decrease the number or even to eliminate the possibility of people, even if they are infected, of dying from this disease. So I would like to exhort my fellow Ghanaians to support the government in the measures that it is putting in place to bring this disease to a halt and revive the confidence again of Ghanaians to do business, to go to their work, to congregate, to encourage one another if there are happy events to celebrate, or if there are sorrowful events we want to support. This will revive the ordinary, or I will even say the proverbial hospitality of Ghanaians that we often speak about. Many of these health personnel have risked their own life in order to put COVID-19 down. As Ghanaians went to Liberia at the time of Ebola, Ghanaians came, Ghanaian nurses and doctors were sent there, and they helped to combat Ebola there. Now these same people with the same expertise are working day and night, sleeplessly, to help eliminate this disease from Ghanaians. I think that we should also make them realize that it has been worthwhile. This sacrifice was not for nothing. And abide by the of behavior patterns. First of all, get tested, know your status, and so that you are not a risk person to the health of others. If you see that you are you have tested positive, it is also an opportunity to assist the experts that you don't become a person who can give the disease to others, and that you can be treated like the many others who have been treated successfully and have come out to resume their life as before.